Hello, esteemed Merville faculty and fellow doctoral students. I'd like to introduce to you my doctoral project named The Impact of Mindfulness and Self-Care Activities on Burnout in ICU Nurses. I am Francisca Nwoko, doctoral candidate at Merville University. On this slide, you will find my DMP committee, which included Dr. Teresa Gacados, my project chair, Augustine Obi, my second reader, and Lisa Friedman, my community member. I will introduce myself to you. I received my Bachelor of Science in Nursing from Oakland University School of Nursing in Rochester, Michigan, currently in the DMP program with Maryville University, St. Louis, Missouri. I work as an ICU nurse with Trinity Health Hospital System in Southeast Michigan. The pandemic has killed almost, if not more than 3 million people and sickened more than 135 million people worldwide. It has simultaneously tasked the nation's nursing workforce in ways that had never been planned for, fully anticipated, and organized for. In addition to the fear of disease transmission at work, taking the disease back to family, fear of lack of employer support when they contacted COVID-19, depression when patients succumb to the virus, ethical decisions regarding care rationing, and drastic changes in workplace practice. The shortage of PPEs, limited access to COVID-19 testing supply kits, were significant psychological stressors contributing to mental health distress in nurses. Frontline workers have worked tirelessly during this critical period. A New York City hospital ED physician tragically committed suicide during the initial wave of the pandemic. This is the unfortunate situation critical care workers face regularly, dealing with ill patients and experiencing regular grief without the opportunity of caring for their mental well-being, without enough time to hit the reset button frequently. Reid 2018 stated that before the current COVID-19 pandemic, 1 in 3 nurses experienced burnout symptoms. Some authors mentioned that stress and burnout creep put providers' health at risk for increased alcohol and substance abuse, broken relationships, depression, and suicide. Kazan 2021, Meta et al. 2021. Zivanovic and colleagues 2019 reported that the ICU is one of the most stressful working environments, and prolonged exposure to stressful work environments can lead to burnout. Camisa et al. 2015. Some of these stressors induce workplace bullying, lateral nurse-to-nurse violence, and so on. The themes of this project include predictors of burnout, burnout and nurse retention, measures of burnout, and interventions of burnout. Some of these predictors of burnout are nursing specialties like the ICUs, nursing experiences like the more experienced the nurse is, the less likely they'll be affected by burnout than the newer nurses. Nursing management often make decisions that impact nurses without giving a thought to how it affects bedside nurses. Also, dealing with critically ill patients and their families are also predictors of burnout. Nurses tend to lead the units, organizations, or departments with chronic exposure to high levels of grief, burnout, and poor job dissatisfaction. This high exodus potential makes retention very, very challenging. The next theme is the measure of burnout, and the Maslach Burnout Inventory Tool, MBI, was used in burnout measurement. It is commonly cited and considered a gold standard in burnout identification and measurement. For this project, the MBI for Healthcare Professionals Human Services Survey, MBI HSS, was utilized. Burnout intervention is another theme. Burnout is a complex problem and requires multiple interventions. But for this project, the intervention is mindfulness-based intervention and self-care activities like communication skills, teamwork, participatory programs, and psychological interventions, including yoga, meditation, and mindfulness breathing. Some studies suggest mindfulness at work, while others suggest mindfulness at home. For this project, participants had the flexibility to choose their location, making it easier for them to adapt the activities they choose. Dr. Hildegard Pepperlau's theory of primacy of therapeutic interpersonal relationships played and still plays a role in psychiatric mental health advanced practice nursing. Pepperlau published her thoughts in 1989 regarding how World War II shaped the early advanced practice of mental health nursing. There was a shift from the previous perception of mental health illness from an innate, inherited etiological perspective to a broader appreciation of the additional contributions of social and environmental factors to mental well-being. This shift was due in part to the return of hundreds of thousands of previously mentally healthy World War II service members with combat-related psychiatric symptoms and disorders. With this awareness came a decrease in the stigma and a shift from housing patients in psychiatric hospitals to treating them in community settings. Unfortunately, the impacts of the COVID-19 pandemic can be likened to the effects of the World War II, with massive infection rates, loss of life, social isolation, and other downstream consequences. During these times of crisis, psychiatric nurses and educators are challenged to provide innovative solutions to meet the increased demands for psychosocial and psychological care. This slide talks about methods and design. A pre and post intervention burnout measurement was done using the MBI tool survey for Healthcare Professionals Human Services Survey MBI HSS. A valid tool that is considered a gold standard in burnout identification and measurement was utilized. It measures all three components of burnout: emotional exhaustion, depersonalization, and personal accomplishments. Education on forms of intervention and links to mindfulness activities were provided, including a wellness activity tracker, a convenient sample of 50 ICU nurses at one ICU in a hospital in the Midwest of Michigan. IRB approval was received from University. This slide speaks about the sample participants and the selection process. The participants were 50 ICU nurses who completed ICU nursing orientation and were employed as full-time ICU nurses. Exclusion criteria are tele-ICU nurses, ICU nurses in management roles, and ICU nurses in orientation. Eligible participants consented, an MBI pre-test was delivered, and intervention education was provided. After the fourth week, a post-intervention test was delivered. When it came to data analysis, a paired t-test was chosen for this project because it was a project to compare the amount of change from pre-test to post-test for the same subjects. But in order to run a paired t-test, the data must meet the normal distribution curve. Therefore, a Kolmogorov-Smirnov test was run to ensure both data sets had normal distributions to run a paired t-test. After the Kolmogorov-Smirnov test, only emotional exhaustion data pre and post met the normal distribution curve. So it was analyzed using a paired t-test, while depersonalization and personal accomplishment data violated the normal assumption and were analyzed using a Wilcoxon signed rank test. This slide shows components of burnout measured with NBI. A high score of emotional exhaustion and depersonalization, and a low score of personal accomplishment is a burnout profile. Hence, scores in red indicate severe burnout, scores in yellow indicate moderate burnout, and scores in green indicate low degree burnout. For this project, the questions asked and the answers collected were grouped into these three categories. This is an overall graphical representation of the responses. The blue bars represent participants' responses before intervention, and the green bars represent the responses after the intervention. Looking at the graph, the participants indicated higher emotional exhaustion and depersonalization before the intervention, represented by the bars in blue, and lower emotional exhaustion and depersonalization post-intervention, shown by the bars in green. These responses were inversely related to personal accomplishment because when people are emotionally exhausted, it is very challenging to feel accomplished at the same time. This effect is supported by the results of responses to the personal accomplishment questions being lower before intervention and higher post intervention, as depicted by the bars in blue and green, respectively. To run a paired t-test, a Kolmogorov-Smirnov test for normality was run to verify if both pre and post data met the assumptions of normality, where the p should be greater than 0.05. P-values for pre-intervention were greater than 0.05, 0.200 for emotional accomplishments, 0.200 for depersonalization, and 0.062 for personal accomplishment, indicating no statistically significant finding. The data are normally distributed, but the p-value for the post showed a mixed result, that only emotional exhaustion met normal distribution curve as shown by a p-value greater than 0.05 at 0.200, indicating that only emotional exhaustion can be analyzed using a paired t-test. Since the p-value for K&M test is less than 0.05 for depersonalization and personal accomplishment, then the data did not meet a normal distribution curve, and parametric statistics t-tests for dependent samples were not appropriate. That was why a Wilcoxon signed rank pairs test was used as shown in the next slide. For the Wilcoxon signed rank test, the p-value should be less than 0.05 to show a statistical significance. In this table, all three components of burnout analyzed with Wilcoxon signed rank test had a p-value of less than 0.05, emotional exhaustion 0.004, depersonalization 0.005, personal accomplishments 0.001, indicating that all three had statistical significance. The main table also shows a 60% decrease in scores for emotional exhaustion, 62% decrease for depersonalization, that's 31 ICU nurses, and a 70% increase in personal accomplishment scores for 35 ICU nurses. This slide highlights both the statistical significance and the practical significance of this project. For a test to be statistically significant on a t-test, the p-value should be less than 0.05, and that is shown in this table where p-value for emotional exhaustion was 0.002. This slide also demonstrates that the intervention has a practical significance as shown by the Cohen's d of 0.47, approximately 0.5. That means that the intervention influenced participants' feelings of emotional exhaustion. It means there is a statistically significant difference between the pre and post responses when compared. This is good because participation in the intervention can then be used to decrease emotional exhaustion among nurses. This slide shows a pie chart representation of the most current recurrent intervention utilized by participants. The activity trackers turned in by participants were analyzed and ranked. The most utilized were meditation and deep breathing, 19%, followed by yoga, 19%, focus on the positive, 17%, all others, including gardening, prayers, etc., were 15%. Walking, jogging, and running occurred 14% of the time. Deep breathing, 13.5%. Meditation, 3%. The differences were locations. Some unique locations were in the car and on the lake, which ties into the project goal to make it easy for participants to fit this intervention without restrictions, prohibitions, or feeling burdened by the activities. Some participants accessed mindfulness and self-care activity links provided by the PI and found them useful. Others devised their own activities to fit their schedule and lifestyle. One of the limitations is the statistical analysis using a paired t-test. The paired t-test means that all data will meet assumptions of normality. Otherwise, it will not work. That happened with this project where um, the data did not meet assumptions of normality, requiring the PI to search for another statistical test to analyze depersonalization and personal accomplishments. Another limitation was that there was no comparison of burnout in non-participants. The participants chose their location, so it wasn't a controlled environment. But the crucial limitation is that the MBI is a self-report tool, and subjects might minimize their reports. For this reason, biological markers are assumed to be more accurate indicators of burnout. This means assessing the hypothalamic pituitary adrenal axis as the most sensitive and reliable method to measure burnout because the body reacts to stress by releasing cortisol. So measuring the cortisol level is a more reliable burnout indicator. There was an improvement in burnout among the ICU nurses that participated. With this improvement, there should be mindfulness and self-care activity tools available to the ICU nurses. These tools should be made readily available and accessible because these are high-stress units. The ICU managers should work with management, hospitals, and payers to develop policies to carry along the nurses, to make them feel heard and cared for. These policies assure nurses that they have support anytime they need support. It will make it easier for the nurses to reach out and seek help. Hospitals should approve mental health apps for their nurses. This should be readily available as phone apps since most people have phones. It will also be beneficial and critical to include mindfulness and self-care activities in the annual nursing competencies. Another important factor is to make use of the new Dr. Lorna Breen Healthcare Provider Protection Act signed into law by the current president, which empowers the Department of Health and Human Services to award grants to health systems for relevant mental and behavioral health training for healthcare students, residents, and professionals. These are ways to make the activities sustainable and improve activities that help buffer the impact of stress and the impact stress causes on the mind and improve the perception of stress. This slide talks about implications for practice. Most of us know that healthy work environment is not an environment devoid of conflict, but an environment where conflict resolution is systematically resolved. Mindfulness activities can improve the work environment by improving nurse-to-nurse caring and reducing incivility in workplaces. Some of the hostilities, like lateral nurse-to-nurse violence and bullying felt in nursing care, are due to stress. A healthy work environment can protect patients' lives because just adding one patient to a nurse's workload increases risk-adjusted 30-day mortality and failure to rescue rates of hospital surgical patients by 7%. Mindfulness-based training can restore mental well-being in the most vulnerable. In this project, ICU nurses and quite frankly, all nurses would benefit from this project. Nurses with optimal mental well-being provide effective, reliable, and safe care, therefore providing optimum care to their patients. When nurses help themselves, then they can help their patients better, leading to improved patient safety and outcomes. Therefore, interventions were geared towards nurses and nursing. The true impact of the DNP project is expansive, with the potential of making a tremendous impact in nursing practice. What I'll do differently will probably be to make the project more expansive to include more nursing units like the ED and include the use of biological indicators of burnout as a mass measure of burnout. In the program, I learned how to conduct a quality improvement project and analyze data, and how to report findings. And I plan on sharing the findings of my project with my manager in a high-level paid report. Finally, I want to thank all the Maryville faculty and my peers who provided critical feedback that led me to this point in the program where I can successfully disseminate my findings. I want to thank the project participants, the ICU managers, and all my colleagues in the ICU for making yourselves available to participate in this project. I want to thank my second reader, Augustine Obi, for her time and encouragement in organizing. I want to thank my community member and the regional manager of the hospital, Lisa Friedman, for her tireless effort in helping to organize and reach out to the ICU managers. I want to thank the CNO of the hospital, Katie Hoffman, for making herself available and offering critical information when needed. Special thanks to my project chair, Dr. Teresa Galcados, whose time and knowledge I found invaluable. With that, I am open to questions from the wonderful audience. Thank you.